outwards. So because of this, the person will have very less space for his chest expansion, and because of that, there will be Shwasa. Once you give Virechana, all the abdominal tensions will lower, the lung capacity will be enhanced, vital capacity will be enhanced, chest expansion will be better, and breathing will be easy. So this is why we should talk about constipation also in the patient who is suffering from Shwasa. Many times we'll be focusing on Shwasa, but we'll be not focusing on Vibandha. Actually, the person is suffering from Shwasa because of Vibandha there. Shwasa is not the problem. You clear the patient's Vibandha, where all the stool goes outside, all the Vayu goes outside, urination happens easily, there is no accumulation in the intestine. Obviously, there will be more space for the thoracic cavity, and then breathing will be easy. So this is the, who says this? So once again, I'll tell you, it is because of the presence of Roganidhana knowledge in this condition, which will help you to understand it better. The next question is whether Vamana or Virechana in Shwasa. First question. Now, how to find out? Shall I give him Vamana or shall I give him Virechana? All that is fine, but how to know them? Again, just take your stethoscope. Keep the stethoscope on the patient's chest. Are you hearing the movements of mucus? Okay, Gurguraka, Shwasa Gurguraka is there, that Gurgur sound is there, narrowing airway sound is there, find it. If it is because of bronchospasm, then the line of treatment is different. Vamana won't help. If it is because of mucus accumulation inside the bronchial tree, then Vamana will help. So differentiate V's with the crepitus, and that will help you to decide whether shall I go with Vamana or shall I go with Virechana. So here also, your Rogi Pariksha matters. You're supposed to find out what exactly kind of assessment we are supposed to do. Here, Shwasa Guruguraka, that is crepitus, if you're hearing, that is because of mucus, and mucus is kapha. Best treatment for kapha is Vamana. If it is because of increased abdominal distension, there is Anaha, Admana, Atopa there is Vibandha there. So the patient is having infrequent bowel movement, once in 2 days or once in 3 days he is passing stools. And along with that, there is also the presence of V's, musical note rather than crepitus. Then Virechana is the best choice. Bronchodilation as well as decreasing the abdominal tension is the best choice. So here I would like to remember one of my students work here. She's a staff in your college. So Dr. Devi has worked on it. She has done this particular investigation during her PG period when she was my student. So you can talk to her about this. So she just took a sample of Arthava or menstrual blood of patients. She cleaned it and saw whether there is stain remaining after wash or not. This is a simple experiment that she has done. She collected the patient's volunteers cloth that has stained with. Of course, it is very tough work. Even I congratulate Sharanya plus Devi for doing these kinds of different kind of work. So some of them had menstrual issues. So dysmenorrhea was there, pain abdomen, irregular periods, everything was there. And they were under treatment also. Despite of taking treatment, so there was no much improvement in their problem. So then Dr. Devi took up an initiation with this idea to find out which dosha, which dhatu, what problem is there in the Artava in this way. So depending upon the color, whether it is Krishna Varna, depending upon the quick dryness, so Rokshata, depending upon the Daurgandhya present over there, depending upon the clots present there, depending upon the vibrance of the color over there, depending upon the presence of or absence of the stain after wash there, she has brought this conclusion. So some of them, which dosha is involved? So in condition where Vata dosha is involved, so we have changed the treatment. So many a times whenever there is dysmenorrhea, everybody will be giving Ashoka Arishta or Kumari Asava for it. No, it is not the same for all kind of treatment. Definitely not. So many a patient, they say for PCOS, they give Virechana. Once again, it's not always advisable to give Virechana for all kinds of Artava Dushti, because we need Pitta for Artava Pravritti, because Artavam is Agneyam. Artava is Agneya. We need enhanced Pitta form for good release of ovum there. If at all, if Artava is not released or if ovum is not released, removing Pitta or decreasing Pitta is not the option. Not at all the option. If at all, if the ovum is ripened, but that ripened ovum is not coming outside, only then Shodhana is required. Otherwise, if you give simply Pittahara Chikitsa in all kinds of Artava Dushti, so there is no Pitta remaining to ripen the ovum, and because of that there will be no ovulation at all. So even by giving Virechana, you may worsen the situation. So don't do that. So not all PCOS can be cured by Virechana. Some require Virechana, some require Vamana also. So there is a condition, especially in case of Granthi Rupa Artava, Virechana is not line of treatment. Vamana is the line of treatment. So it is told by Dalhana actually. So he told Urdhva Shodhanam from Urdhva Bhaga. So Urdhva Bhaga Shodhana is what? It is Vamana. So it is wrong concept that whenever there is problem to the Artava, give Virechana. No, we need aggression of Pitta because that Ushna Guna is required for ovulation. So we all know that during ovulation, 1 degree of temperature increases. Why? This enhancement of temperature is very much essential for ovulation. And if you give this kind of Virechana, not all, of course, sometimes we need Virechana. When is that you need Virechana? When is that you don't need Virechana? These kind of pariksha will help you. So that's what she has done. She has gave us an explanation what kind of Artavadushti is this, which dosha is involved in this. After finding which dosha is involved, we treated the patient likewise. So in the condition where there is vata involved, we gave jiraka, the grita which is associated with jiraka we have been treated. And the one which is present with pitta, simple phalagrita we just gave it. And the one which is having kafadushti. So there we have given arishta base. So Ashoka arishta we gave only in kafajartha. This is my perception. That's what we have done. And after that, the patients showed significant improvement. Okay, so always one medicine to 100 people, no. I always get annoyed when people ask me data for you say that you have treated so many patients. Can you just show me data? How can one medicine, same medicine, cure 100 of people? No, because even though it is jwara is common in everybody. Not everybody will respond for the same medicine. Sometimes we give Amrita Rishta, sometimes we give Mrityunjaya Rasa, sometimes we give Inguleshwara Rasa. Why these textbooks told so many medicines? One medicine is sufficient, no? Why there is choice of so many medicines? Because every body is different. Every body will respond in different way. You have to find out which is the avastha of dosha, prakriti of the patient, agni of the patient, sensitivity of the medicine to the patient, everything we are supposed to check. And then you have to decide, okay, this medicine is better. So the patient is suffering from joint pain. Some patients we give kottam chikkadi. Some patients we give another lepa. Sometimes we give basti. So that is not that, even though the patient is having joint pain, the other factors that are influencing is different in different people. So we have, Dr. Devi has done the same work with this particular work. So it's a great work. I don't think any other work I have seen this way. You can please look into this. It's okay. It will just, these kind of investigations helps us a lot. So that's why I said Ayurveda Roga Vijnana is much more advanced than present diagnostic techniques, because it will tell you those factors which even X-ray, CT, PET scan, biopsy, nothing says that Ayurveda says. So simple example is Nadi Pariksha. There is no need of any machines or any technologies, if at all, if you are a good Nadi Vaidya. So just feeling the Nadi, the texture of it, it is possible for you to diagnose the disease, then forget about all these investigations. So many of the times people come from poor background. So most of the times they will spend their money for investigation. All these investigations are very, very expensive. And then they have very less money for treatment. So if we develop these diagnostic methods, like this kind of Vastraranjana Pariksha or Nadi Pariksha or Mala Pariksha or Taila Bindu Pariksha, if we do that, so there is no, how much all this will cost? I think Dr. Devi will tell. She just used money for, I think that surf packet, sachet, that's all, just to wash. Not a single rupee was used for conducting this particular experiment. Okay, so only thing is some people will feel odd about this kind of, it is unethical something. No, it is something beyond science, all these investigations. Science cannot explain all this. So it is beyond science, ahead of science, all these descriptions. They are supposed to consider. Next part is some diseases like Graha Roga, Bhuta Vidya, evil spirits, all those are not visible. But still those kinds of diseases are there. Many times they say it is superstition. No, it's not superstition. It is not fake. There are some real things also. The problem is there are some quacks who mislead people. Because of them, the entire community will lose its reputation. So because of this problem, a great branch of Ayurveda, that is Bhuta Vidya, is almost getting amputated from Ayurveda. We say Ashtanga Ayurveda, but all the 8 branches are practiced today. All are practiced except Bhuta Vidya. We are losing Bhuta Vidya. We are supposed to hold it tight. I have told the same thing in my earlier webinar also. Let not go this great branch of Ayurveda consider it, work on it, do research on it, and bring it back. So moving on. So Roganidhana tells us the prognosis of the person, whether it is sadhya or asadhya or not, whether it is sukha sadhya, kricha sadhya or not. It gives you about the prognosis. And then it gives about the hint of the line of the treatment also. So for example, if the patient is suffering from Kamala, so there are two varieties of Kamala, Shakashrita Kamala, Koshtashrita Kamala. Shakashrita Kamala is mainly caused because of obstruction or Sangha, structural obstruction. So it is usually obstructive jaundice. So for obstructive jaundice, surgery is the best option. I think 2-3 patients came to me with this gallstones that are present in their gallbladder. They came to me. So it was an acute condition, and it was almost it has closed completely the duct of the gallbladder, and almost the person was going towards pancreatitis also. So in this condition, they were surgery is must for this because it is a shastra sadhya chikitsa. Many of the time people think that Ayurvedic medicine means it is herbal and Western medicine means surgery, and they rush to us. Doctor has told us we should do surgery. It seems I'm scared of surgery, so that's why I have come for Ayurvedic treatment. Now tell me, Shalya is a part of Ayurveda. Surgery is part of Ayurveda chikitsa. Actually, we discovered Shalya Tantra. I mean, Sushruta is said to be the father of surgery, and people think that surgery is not Ayurvedic part. It's ridiculous. That's not happening. We are supposed to educate. No, for Shastra Chikitsa Vyadhi, Shastra Chikitsa has to be done. And for Aushadha Sadhya Vyadhi, we give Bheshaj Chikitsa. That's all. So we cannot cure Shastra Sadhya Vyadhi by using Bheshaja. So you are supposed to educate the patient. So in obstructive jaundice, if it is caused because of obstruction produced because of the gallstone, and if the size of the gallstone is bigger than the outlet, surgery is a better option. Now, what kind of surgery, whether it is laparoscopic surgery or, well, that's not the job of the pathologist to decide whether what kind of surgery. So decision by the surgeon. Otherwise, if it is Koshtashrita Kamala, where there is excessive production of pitta, and that pitta has to be eliminated, then Nitya Virechana has to be given. So that is Aushadha Sadhya Kamala. So it will tell you Koshtashrita Kamala, Shakashrita Kamala, if you diagnose what line of treatment is better. So a Roganidhana person will be a better person to decide. And again, as I said, Namajvara as well as Purana Jvara. We give Langana in case of Namajvara and Virechana in case of Purana Jvara. And in case of Rajakshma also. So how to treat Rajakshma? So first of all, you are supposed to start with the Agni Deepana, Amapachana, mild Shodhana. After that, you are supposed to give him Brahmana. After that, you are supposed to give him Rasayana. Without doing all this, directly if you give Rasayana at the very first stage, so many patients who are lean, they'll tell doctor, I have to increase my body weight. Can you give me some Chavana Prashas, Avalehas to increase my body weight? And directly if you give them Chavana Prashas or Avalehas, no, it's of no use. Because you have to go through all this. Why there is Kshaya? Is it because of genetic? Is it Prakriti of the person? Or has it because of Dirgha Kala Vyadhi Anubandhi is there? Because of that there is body weight reduction. Or nutrition is not happening because of Pandu, whether there is Kshaya, and because of that he is looking Kshina, or whether it is because of Kshatakshina, whether all the Saptadhatus are not produced properly. Is there any obstruction in the Paranama Avastha of the Dhatus? You are supposed to check it. And only then you are supposed to give the treatment. So that's why Agni Deepana first, Amapachana next, Shodhana afterwards, then Brahmana, and then you are supposed to give him Rasayana. So who decides this? So you can find it, which avastha the patient is going through and what line of treatment you can pick it up. Then Atisara, as I told you. So Tadarthakara Chikitsa. So patient who is suffering from Atisara, and if it is Nama or Amavastha, in the first stage of Atisara itself, if at all if you are having, if the patient has come to you, then it is better not to give this one Stambhana there. Don't give Stambhana. Give Amapachana Dravya. Better give Takra that is mixed with the Shunti, Maricha, Pipali, Jiraka and all that. And because Shunti has got that Grahi property and it has got Amapachaka property also. So that is a better way. If at all, if the patient is not suffering from Amatisara, then only you can think about Stambhana. If you give Stambhana Chikitsa in the Ama stage, that means you are converting the patient who is suffering from Atisara to Grahani. All Grahani is caused because of improper management of Atisara. Every Atisara patient, whoever is mismanaged, will ultimately land up in Grahani. So that is the description told in Grahani chapter itself. One more example I am going to say, Vibandha. So patient who is suffering from Vibandha or constipation, there are so many reasons to cause constipation. So in some patients, constipation may be because of dry stool. Stools are very dry, that's why elimination is not happening. In some patients, stool is normal, but the uh, anal canal is very dry, lumen is very dry, or constricted lumen, dry as well as constricted lumen. So stool want to come, but because of constriction, evacuation is not happening. In some people, stool itself is not produced. So what is it? The symptom is one, constipation. But is it because of dryness? Is it because of lumen disorders? Is it because of any obstruction like piles or foreign mass? Because of that, the stool is not coming outside, or stools are not produced, prepared properly. The line of treatment is different. In the condition where stool is not produced, you are supposed to give fiber-rich diet. In the condition where the lumen is dry, you are supposed to give him uh, sneha dravyas, because of which the lumen gets lubricated and stools will easily flow outside. So, but many of the times I see some of them give churnas for this. So don't give churnas in the condition where the lumen is dry. So dry intestinal walls will, by churna intake, again it will worsen the situation. So it's better to go with sneha. The eranda taila is better choice because it will just give snigdhata to the lumen and the stools will flow easily. Bust is a better choice for all these conditions. So this has been explained very well if you understand nidana properly. Okay, so it can be vibandha can be because of pakvashayagata vata, it can be because of udavarta. So a roganidana person can differentiate which is pakvashayagata vata and which is udavarta. He only can differentiate and then cure vibandha. So vibandha is constipation. It can be because of pakvashayagata vata. It can be because of udavarta. So what the patient is suffering from? Is it because of pakvashayagata vata or udavarta? Roganidana person will give an expert opinion and then treatment can be started likewise. The next one, start the treatment with upashaya and anupashaya in your mind, always. So ultimately, sometimes even though you have diagnosed properly, there may be some minor things that you may miss. So once again, I'm proud to say Dr. Vaishnav has done a tremendous job on this while talking about differentiating types of gridrasi. He has done some work on it, Vataja, as well as Vatakafaja gridrasi, as well as some work he has also done whenever he was working with the sports medicine also. And many a times, Gata Vata, also he has worked very well. And Ekanga Vata, Sarvanga Vata, also how to differentiate, he has worked very well. So here also, so Upashayatmaka Chikitsa is better, you better start with it, because best example I can give is Kateshula. Kateshula can be produced because of Vata, obviously it will be produced because of Vata, but there are gunas of Vata, whether it is caused because of Ruksha guna of Vata or whether it has produced because of Shita guna of Vata. So because of Ruksha guna, because of dryness, there will be poor lubrication to the joint, and because of that the person may have Kateshula, one thing. And because of Shita guna, there will be stiffness. The person, it will be not that flexible. While moving, bending forward or sidewards, the patient will have problem. That is because of stiffness. Now, because of Shaitya guna or Shita guna of Vata, there will be stiffness. And because of Ruksha guna of Vata, also there can be Shula. Now, how to find out? Because X-ray will not tell you. No X-ray will tell you whether it is Shita guna or Shaitya guna. No MRI, no CT scan will tell you which guna of Vata has produced Kateshula. So, you just do one thing. Take small amount of Tila Taila and do Abhyanga to the patient's low back. So if the patient is showing relief in his symptom, that is because of Ruksha guna of Vata. The patient is having Kateshula because of Ruksha guna of Vata. Because as soon as you have put Abhyanga, as soon as you have put oil to the thing, the Ruksha guna was being compensated by the Snigdha guna that is present in the Taila. That is why the person is not having any kind of low backache after you give Taila Abhyanga. Now, if you have done Tailabhyanga to the patient, but still there is no much effect in his symptom, there is no improvement in his symptom, try giving Ushna Guna Lepa in the form of any Agarwadi Lepa or whatever it is. Just, of course, it should not produce much Rukshata. So give him Swedana better. That's a better choice. Soon after giving up, just go with Swedana. Now, the Ushna that is present in during the time of Swedana, so that will break off or cut off all the Shaitya guna that is present in the Vata, in the low back ache, in the Kati Pradesha, and give good flexibility. So Kateshula is same, but it may be because of Ruksha guna of Vata, because of Snigdha guna of Vata. Which line of treatment shall I? Even though it is Vata only, no doubt it is because of Vata only, but shall I give him Abhyanga, or shall I give him Abhyanga plus Sweda, or shall I give him Shunti Churna, Upanaha Sweda? Okay, it can happen in lower joint also. So Upanaha Sweda also can be given in such condition. You are supposed to find this point. That is why Upashaya and Upashaya is still required even though you are sure about diagnosis. Now the patient came with Katishula. I am very sure it is Katishula, and I am also very sure that it is produced because of Vata. But in Amshamsha Vikalpana, I don't know what factor of Vata has produced the pain. So I have to go for Upashayatmaka Chikitsa. We have for this lot of tools. We have Rogi Pariksha, that is Nidana Panchaka, by Roga Pariksha, and Rogi Pariksha with Trivida, Chaturvida, Panchavida, Shadvida, Ashtasthana, and finally Dashavida Pariksha. The question is when to apply this Dashavida Pariksha. Many of the times, even myself, when I was a UG student, I used to do Dashavida Pariksha. We all used to do the Dashavida Pariksha. And after that, in the case sheet I'm talking about, we all have case sheet, no case records. So in that, we have name, age, all that vital data, present complaint, past complaint, then all the general examination, systemic examination. And after that, we have Nidana Panchaka, then we have Samprapti Gataka, and then we go for Pariksha, that is Trivida, Chaturvida, and all. And then we have Dashavida, and after that, we have diagnosis. No, it is wrong. You should do Dashavida Pariksha after the diagnosing the disease of the patient, because you are doing that pariksha for assessment of treatment of the patient. For example, you have selected, okay, I will give Shodhana to this patient. That's what you have decided. So Kamala I will take. So he needs Virechan. That's what you have decided. And you diagnose it is Kamala, that to Koshtashrita Kamala. Virechan is the best line of treatment, and you have handed over the patient to Panchakarma expert. But that is not the end of your work. Now, here also, a Panchakarma expert also should once again do pariksha to the patient. Yes, he is supposed to check the patient's Agni. He is supposed to test the patient's Koshta. He is supposed to give a small test dose of Sneha and assess Abhyarana Shakti, Jarana Shakti, Ahara Shakti, Vyayama Shakti, Sattva, Satmya, all that, and then decide which type of medicine is suitable to him. Some of the patients do have some allergic issues with some of the medicines. You are supposed to know that. You are not, even though patient is fit for that, you cannot do it. Some treatment is contraindicated to the patient. Once again, I'll give you the same example of Shwasa. There was a patient who had lot of mucus accumulation in his lung, but he is a very fit patient for Vamana. But Vamana is contraindicated in him. As a Vyadhi, Vamana is the best choice. So as Roga Pariksha, Vamana is the best choice. But when we examined the patient, he had hiatus hernia. What is hiatus hernia? A part of stomach gets protruded from the perforation of the diaphragm. So you have a diaphragm, and you have a small hole in the diaphragm in the left side. In the left side, you have a small, because it has esophagus has to enter through that hole. So in that hole, esophagus goes, and that is why that hole is there. So from that hole, so this is how esophagus enters. Sometimes a part of stomach protrudes outside from that opening along with the esophagus. So esophagus and little part of the stomach comes out. So it will be very painful. So just pain, just discomfort occurs during this time. So such patients are not fit for Vamana. Even though disease says his Vamana is given, but patient's body is not suitable for Vamana. Same like that, some patients are not suitable for surgery, some patients are not suitable for Agni Karma, some patients are not suitable for Rakta Mokshana. So patient will not be suitable. So I am not at all suitable person for Panchakarma with reference to Snehapana. I cannot take Gritapana. So oral intake is not at all possible. Soon, when I just take a mouthful of Grita near my mouth only, I will start vomiting. Because I have lot of asatmia for Sneha. I think after my school days, I never had ghee or oil, because I get aggravation of lot of mucus secretion occurs whenever I have any kind of Sneha inside me. So I'm a fit person for Shodhana, but I'm unfit for Snehapana. So how I came to know? That is because of Dashavida Pariksha. Dashavida Pariksha should be done before treatment, after diagnosis. But still, you should know about this for assessment of what should be the rate of medicine, how long should be the treatment process, what should be the dosage and what should be the duration, what kind of medicine should I select. Shall I select some Tikshna Aushadhis or shall I go with Mrudu Aushadhis? All that has to be assessed before treatment. That is called as Chikitsa Purvaka Pariksha, and that has to be done before treatment but after diagnosis. Well, coming to a little deeper aspect, Nidana is used for preventing of recurrence. As said earlier, once again I'll repeat the same example. We are supposed to give Virechana for Punaravartaka Jwara, because Punaravartaka Jwara, that is Jwara repeats once again because of incomplete elimination of doshas. So all of you have suffered from Jwara, isn't it? So whenever you are suffering from Jwara, when you will come to know that you are free from Jwara, not just reduction in the temperature, when you start sweating, that is the right time when you come to know that you are getting cured from Jwara. So because the ama that is present inside the koshta has blocked this Vedava srotas, and then once you start sweating, that means that ama has melted, and that is how it is coming outside in the form of shwasa, in the form of svedana. So the sweat drops comes outside, and that is how all the ama has melted and come eliminate outside naturally in the form of sveda. If this has not occurred, that means ama is still there inside your body. So when you treat the patient of Jwara, temperature is not just the criteria. Temperature is not just the criteria. Elimination of ama is the criteria. So it's always advisable for you to give one Virechana at the end of any kind of Jwara. So one more thing, Nidana for preventing disease proper. In every season, we have a Panchakarma procedure. So for example, in case of Vasanta Rutu, we have Kafaja Vikaras, more prone for the patient. Before Vasanta Rutu, if you give Vamana to the patient, there is no chance of Kafaja Vikaras because during Vasanta Rutu. Same time during Sharat Rutu also, Pitta Prakopa occurs. So before that, if you just give the patient Virechana, then that means all the disease that is caused because of Pitta will not be there during the time of Sharat Rutu. So the entire diseases will be prevented. So I sincerely advise all of you, not only you, your family members or your patients, to promote Shodhana before manifestation of the disease. Even though you have practiced so many healthy foods and all, still one or the other ama will be accumulating in the body knowingly or unknowingly. Periodically, if you remove it, so there is no chance of dosha sanchaya. If no sanchaya, no prakopa. If no prakopa, no prasara. If no prasara, no sthana samsadaya, no vyakti, no beda, no vyadhi at all. So that is how you are supposed to prevent the disease. Okay. Last point, Nidana avoiding disease progression as well as complications. So it will avoid complications. If you treat the patient properly, the disease won't progress, and the disease won't progress. That not only that, it will not give you any complications if you have given the treatment according to the Nidana of the patient, not just simply according to the Nidana of the patient. Nidana for identification of the cause of the disease, very, very important. If you don't know the root cause of the disease, trust me, you cannot treat the patient. Cannot treat the patient. So patient came with headache. Okay, so we give Shiroshulari Vajrarasa, Patyadi Kada for the patient. Okay, so but why the patient is having this headache? Because she didn't sleep. Why she didn't sleep? She's worried about her, current studies or whatever it is. So the disease is actually not in the shiras. It is there in the manas actually. So that is a side. So chinta, shoka is the reason for her Shirashula, not exactly this ama or mityahara, vihara, vatavritti. No, not just all that. It is the chinta that is giving her stress. So find the cause of the patient. So at the same time, the patient came with atisara or loose stools. So kutaja, no, always kutaja won't work. So the patient who was having fear that he may fail in an exam. So that is bhayaja atisara. So the treatment is not to the agni, koshta or ama actually. The treatment is to the psychology here. So identify what exactly the cause. Is it the stress? Is it the food? Is it the genetic factor? Is it the lifestyle? Is it the absence of sleep? Is it the radiation? What exactly is the cause of the disease? You are supposed to identify, and then only you can treat the disease properly. The Nidana for understand the severity of the disease. You're supposed to know whether, because sometimes patient will have small symptom, but patient will cry as if he is having a very, very severe disease. It has happened. So patient came screaming a lot, but it is just a small insect bite or something. That's it. So, but the patient expresses as if a very grave symptoms are there, disease are there. Not really. At the same time, there are some patients who are very, very tolerant and who are very good sattva bala, but have a very, very major issue, but it won't be expressed outside. They won't show that they're having that much pain because they are having such a strong sattva bala. But within, they are quite sick, quite sick. So this is, but if you do the pariksha properly, both inside as well as outside, using all the tools of diagnosis, it is possible for you to differentiate Guru Vyadhi as well as Lagu Vyadhi. Nidana as assessment criteria, that is the third point. So always you will come to know whether your medicines has worked properly or not. You will take the parameter of Lakshana or Rupa, parameter of laboratory or